Okay, so most common causes that I see in the clinic. Okay, so I've simplified this into two really. So number one is tissue overload, and number two is where there's a rapid lengthening of the tissue, such as that poor guy that's after falling over the box down there. So tissue overload, what is that? If you look at this diagram on the left, it's just a stickman diagram of a leg, and it's a rough sort of guideline of what ideally should happen when you're walking or when you're running, when your foot hits the floor, or when you're bending down to pick something up. So the lower part of the leg, from the ankle or the foot up to the knees, so your calf muscles, your shin muscles, they want to take about 25% of the workload. Your hamstrings at the back of the leg do 25%. The quads there at the front do 25%, and then the glutes and the bum muscles do 25%. So that makes up 100. Everything is nice and happy. Now, if you've had an old, say, ankle injury, for example, what can happen is that in order for that ankle injury to heal, you're going to limp for a while, you're going to take pressure off your ankle, and that's a natural way of letting your body heal. That's okay. The ankle injury is going to go, or the pain is going to go away. You're going to get back to walking. But if you decide to take up running, say a year later, then that can become an issue because your body may still have a little bit of, it might be a little bit protective over that ankle if you didn't rehab it properly. So in the example on the right, the lower leg is only doing 5%. Maybe there was an old ankle injury there or a calf strain. Then the hamstring isn't going to do its job because the two of them link in together at the back of the knee. Hamstring is doing 5%. The glute is not going to work efficiently because that relies on the lower, the calf muscles and the hamstring muscles to work effectively for the glute to do the work. And then that's 15%. Then the quad muscle at the front has to take up the rest of the workload, and that ends up doing 85%. Now, these are just rough guidelines just to give you an idea of what I'm talking about. But if your quad muscles are doing 85% every time you're running, every time you're going down the stairs, getting up out of a chair, they're going to get overloaded. They're going to get grumpy. They're going to send messages up to your brain saying, look, I'm doing an awful lot of work here. Can you help me out? And your brain responds by giving a protective response of either tightening up the area further or by giving you a sensation of pain. So that is when the tissue becomes overloaded. So the quad muscles here are a big one for knee pain because they actually come down the front of the leg, and they just they cross over your kneecap, and they insert just below the kneecap into the shin. And if they're very tight, if they're working quite hard and doing 85% of the work for you, they're going to be putting an extra compression on the kneecap. And say if you have an old bit of, or say if you have a little bit of cartilage wear and tear, or if you have a slight meniscus injury, that normally is fine, but all of a sudden you've taken up running, your quads are now doing 85%, then that's when that can become an issue, and that sensitizes it further, I suppose, so that you end up with the experience of pain in your knees. Does that make sense to everybody? Hope I've explained that. So if you could just pop a 1 in the chat if that makes sense. If you'd like me to go through it further, pop in a 5.